Okay, we're now at the specified read time for the 6-in-1 saliva test, which is 10 minutes, and we're going to show you the results as shown on this test. So, if we bring this to the camera, you can see, rotating the tube around, we've got 6 individual results. The drug being tested is indicated by the international abbreviations on the coloured part of the test strip, and then you're looking for test and control lines to form with a nice clear background. And on this membrane, as we rotate it round, you'll see that we've got very nice, clear, easy to interpret test and control lines showing, indicating, as on your indicative panel here, fully negative results. Now, if any of these tests had detected drugs in the saliva sample, you would have a control line showing, but no decipherable or even a faint no test line showing at all at the 10-minute read time. If you don't get the control lines forming at the top of these test panels nearest the coding on the test strips, that is an invalid test. And the commonest cause for that is inadequate sample collection, i.e. the swab's been too dry when it's been squeezed into this tube, and there's not been enough saliva to absorb sufficiently onto all 6 of the membranes in this test. If that occurs, it is possible for you to remove the test swab and ask the person to re-saturate it with further saliva, or to give you a saliva sample into a clean glass jar or container, food quality plastic container, and saturate further saliva into the swab and then apply it into the bottom of this test membrane. But without adequate saliva, you will not get all 6 tests showing. But this is a lovely clear result showing all negative. What you can also notice, I don't know whether it's picking up in camera, but it's a good indication that this was completely saturated. You can see a saliva level very erratically going around the side of these tubes, particularly where the membranes are close to the side of the plastic tube. Further saliva has run osmotically up there. That's an indication that there's a good volume of saliva in this. Now, if you do have a positive and need to send the sample for laboratory confirmation, this whole tube can be labelled, witnessed and sealed. Security seals aren't actually supplied routinely with these packs, but are available to buy online, which will seal the lid, and that can be signed over the seal and the whole thing sent off for laboratory confirmation, because there should be no evaporation or loss of the saliva once this tube is locked. Okay, so that's the WHPM 6-in-1 saliva testing kit. Very nice, easy and accurate test to do. Great thing about this is the chain of custody issues are completely overcome by being able to conduct your sample collection directly in front of both examiners without any potential for the sample to be adulterated or substituted. These are available from UKDrugTesting and Value Breathalyzers and ValueMed websites.